Good afternoon, everybody. I appreciate everyone joining us this afternoon for this presentation about Medicare Advantage, where we will present some important talking points to help you understand the importance of pursuing Medicare Advantage plans and offering those to your clients. The Medicare Advantage market is exploding right now. A recent article from Forbes magazine that will be talked about throughout this presentation says that 22 million beneficiaries, or 35% of all Medicare beneficiaries, are enrolled into Medicare Advantage plans. And that number is only going to climb significantly throughout the next several years. So it's a very important market to be in right now, and a very important product to be offering to your clients. Making the presentation is Tamara Kunz, a agent manager with UnitedHealthcare here in the Nebraska market. And also want to let you know, too, that there will be an opportunity for questions and answers at the conclusion of the presentation. To ask a question, just type your question into the questions box that you see there on your computer screen on the GoToWebinar control panel, and we'll address all those questions at the conclusion of the webinar. So with that, I want to turn it over to Tamara. And Tamara, thank you very much.
Yeah, thank you. Thank you, everyone, for joining today. Appreciate having you on the call. I'm going to take a little bit of time and talk about Medicare Advantage and some of the importance with the upcoming changes. So let me see here. There we go. So I'm going to talk about why Medicare Advantage, talk a little bit about some of the election periods, the different types of Medicare Advantage plans, and some of the growth that's been happening over the last several years and projected to happen here in the next upcoming years as well. So as you guys all know, when it comes to Medicare, there's definitely some choices that clients have. So with enrolling in original Medicare, they have Part A that covers hospital and Part B that covers doctor visits. They get their red, white, and blue card. And then to help fill in some of those gaps with original Medicare, some of the coinsurance and co-payments, deductibles, there's a couple different options that people can take. So option one is going to be the original Medicare option with a Medicare supplement, which is offered by private insurance companies. The Medicare supplement is going to come in and fill some of those gaps with original Medicare. It's going to provide just some additional benefits and fill in those gaps and make sure that they have the coverage that they need so they're not getting huge out-of-pocket expenses when they go into the hospital or doctor. With the Medicare supplement, it's typically, it's not network-based, so as long as a hospital or a doctor's office accepts Medicare, then they can go in and use their Medicare supplement there. Medicare supplement does have a monthly premium with it. That will vary depending on the type of Medicare supplement they get, but they will pay monthly to have Medicare supplement plans, typically around $100 to $125 as they turn 65. We'll get them onto a Medicare supplement, and that rate can go up every year. With that Medicare supplement, they'll need to get a prescription drug plan as well, and the prescription drug plan is going to have a monthly premium as well with a formulary to help with that drug coverage. So today what I'm going to be talking about is Medicare Advantage plans, also known as Part C. On this chart here, that's actually option 2, which is in blue. Medicare Advantage plans, or Part C, is also offered by private insurance companies and actually combines Part A, which is hospital, and Part B, the doctor, into one coverage. So they'll have one ID card that has all that coverage included. It's going to help fill in those gaps, and it's going to provide additional benefits. Sometimes a Medicare Advantage will include dental, vision, hearing, sometimes a gym membership, sometimes over-the-counter catalog credits, but a variety of additional benefits as well. And then Medicare Advantage plans typically include a prescription drug coverage as well. So not all Medicare Advantage plans have drug coverage, but most of the plans do. And with Medicare Advantage plans, there's typically a very low monthly premium or no monthly premium at all. And then when people go in to use that coverage, if they go to a doctor's office or a hospital, they would just pay a copay or coinsurance with it. So it's more of a pay-as-you-use it versus the Medicare supplement. You pay that monthly premium to have that coverage, and then they don't pay as much when they go into the doctor's office. That's a big kind of difference between those two plans. So within a Medicare Advantage plan, there's a few different options that are available. First one that I'll talk about here is the Health Maintenance Organization, also known as an HMO plan. The HMO plans are going to be very network driven, so they need to stay within their network of doctors and hospitals. If they go out of network on an HMO plan, they're going to incur the whole cost. The only exception for that would be emergency care or urgent care visits. So if someone's traveling and they go, they get in an accident, they go to the hospital, it's an emergency, they're going to be covered. But if they want to go in and get a checkup and they don't go to an in-network provider, then they're going to get the cost of that. With the HMO plans, they're going to select a primary care provider that's going to help them coordinate their care. So with all of the HMO applications that you take, there's going to be a spot to put down their primary care provider's information. All right, another plan that I'll talk about here is the Preferred Provider Organization, or a PPO plan. This has also a contracted provider network. All the benefits covered in network are also available out of network, though, but generally at a higher cost to the member. So with the PPO, there's a little bit more flexibility with the network. Typically, if someone on a PPO goes out of network, they'll just have a little bit higher cost, a little bit higher out of pocket with it, but they can still get some coverage from their plan. The next one I'm going to talk about is the Private Fee-for-Service plan, also known as PFFS. With a private fee-for-service plan, members can seek treatment from any Medicare-eligible provider who agrees and accepts the plan's terms and conditions. And they do not need a primary care provider selected when they sign up for a private fee-for-service plan. It's still going to be a regular Medicare Advantage plan. They pay co-pays and co-insurance when they go in to use it, a little bit lower monthly premium with it, but just gives them more flexibility with the network. And then finally, special needs plans. This provides healthcare for certain groups of people. So we have our dual special needs plan for people that are on Medicare and Medicaid. We have institutional SNP plans for people in nursing homes or in a skilled nursing facility. And then we have chronic special needs plans as well. That's for people with a chronic medical condition. So there's quite a few different options when it comes to Medicare Advantage. These are not all offered in every county. So when you guys are looking for your areas and trying to see what plans are available, it's important to know that there's not going to necessarily be all these plans in your market. But if you want to check and see with UnitedHealthcare what plans are available, or even with all other carriers, Medicare.gov is a great resource to check to see what plans are offered. And the UnitedHealthcare site, uhcjarvis.com, is another really great spot to check to see what plans are available in your area. All right. So with Medicare Advantage plans, when I first started, I've been in the business about 4 years now, and when I first started, I came across a lot of the kind of common myths. So I like to kind of get out in the open and talk about some things that people who typically don't work a lot with Medicare Advantage plans think right off the bat. The first one I get, or I have received a lot over the years, is if you like to travel, you need a Medicare supplement plan. And while the Medicare supplement plan offers a little bit more flexibility with network, just because you travel, it doesn't necessarily mean that a Medicare Advantage isn't a good fit for your member. So Medicare Advantage plans with UnitedHealthcare, most of them offer the Passport program. The Passport program has, here's a little map of our Passport program, all of the states that are in blue actually are part of the Passport. So if someone who lives in Nebraska wants to spend their winters down in Florida, they can actually turn on their Passport program, and then their plan and all their benefits will work down in Florida in the county that they're going to, as long as it's included in the Passport network. So before they travel, they can call member services and make sure that the place they're going to is participating in Passport. But that way, if they want to go to a doctor, have an annual checkup, they can do it at no additional cost. It'll just be part of their regular plan offering. So it's a pretty great benefit with Medicare Advantage on the UHC side. Another great thing is there's worldwide emergency coverage. So if someone, like I said earlier, if someone's in an accident and they need to use their healthcare services, they're able to with a worldwide emergency coverage, and it'll be treated as in-network. Another thing a lot of people will ask is, or state, is that Medicare Advantage has a very limited network. And that's also not true. We actually have a fairly extensive network in most major metro areas that have most of the major hospitals included. Across all carriers, not just UnitedHealthcare, if someone expands into a new county with a Medicare Advantage plan, they actually have to meet certain requirements by CMS. And part of the requirements is having a network. So there needs to be an approved amount of providers in the network before we can expand into a certain county. So if you're looking at the network and you're thinking that HMO, sometimes there's that hesitation with using HMO because it is a network-based plan. Before you let that shy you away from writing a Medicare Advantage plan, I definitely encourage checking out the network and making sure that you understand it, because there's typically most of the major hospitals in network, and which is a really great benefit for the members. Another thing we've heard, with Medicare Supplement, when they turn 65, they don't have to go through underwriting, which is a great benefit with the Medicare Supplement. But sometimes people worry if they don't take that Medicare Supplement right away that they'll lose that guaranteed issue. There's actually a trial right for Medicare Advantage, and this works for people that turn 65 and for people that, let's say, maybe are 75 and they choose to sign up for a Medicare Advantage plan during their open enrollment period or annual enrollment period. They can try the Medicare Advantage plan and for a year, and then if they decide that they want to go back to their Medicare Supplement plan, they can without having to go through underwriting. So there's kind of some safeguards that are put in place for people that come off of a Medicare Supplement, or even someone who's 65 and wants to start with a Medicare Advantage. Maybe they decide it's not the best fit for them. They have that year of a trial period to get back onto a supplement without going through underwriting. All right, so the Medicare Advantage program, just going to talk through some details here. So enrollment, like was mentioned earlier, has actually doubled over the last decade. There's over 20 million members, 22 million to be exact. 35% of all Medicare eligibles are actually currently enrolled on a Medicare Advantage plan. And that surpassed a Medicare Supplement plan about 2 years ago. That's in close second with about, I think, 33 or 34% membership on the supplement side. So a very large percentage of people are actually already enrolled on a Medicare Advantage plan. And another interesting statistic with people that are turning 65, 66% of all people nationally that are turning 65 are choosing Medicare Advantage plans. So it's a very big amount of people out there that are turning 65 that are choosing to go with a Medicare Advantage plan versus a Medicare Supplement. And that's not to say that a Medicare Advantage plan is always the right fit. Medicare Supplement, you still have to work with your client, make sure that you're evaluating their needs and seeing what plan fits best. It's just showing you guys where some of the trends are going, and that it's important if you aren't currently offering Medicare Advantage plans in your portfolio that you look at getting that added so you can offer even more value to your members. All right, so access. I was talking about Medicare Advantage plans. Most of them include a prescription drug plan. Actually, 88% of Medicare Advantage plans are including a prescription drug plan. And over 50% of Medicare Advantage plans don't have a monthly premium. So that's another great thing to have in mind if it's a financial issue. Over half of the Medicare Advantage plans don't have a monthly premium associated with them. Additional benefits. So the Medicare Advantage plan, like I mentioned earlier, wraps in some of those extra benefits. 62% of plans have dental, 70% have fitness, and 77% offer vision. So some of those great benefits that someone might not get with original Medicare are tied into most Medicare Advantage plans. And the impact. 90% of members are enrolled in a plan with a 3.5 star rating or higher. And 91% of seniors state that they're satisfied with their Medicare Advantage plan. So I kind of mentioned there's some additional benefits over original Medicare. This screen just kind of shows some of them. I'll highlight some of the big ones that Medicare Advantage plans offer. So dental, vision, hearing, kind of talked about that. Medicare Advantage plans also offer 24-hour fitness or 24-hour nurse line. So if someone has a question and they want to call in, our UnitedHealthcare plans offer a nurse line that they can call and ask questions. A lot of our plans with UnitedHealthcare offer fitness. I mentioned the Passport program. We also have over-the-counter catalog benefit, so items like vitamins or different like bandages or even toothpaste. There's a lot of different things that are offered in the over-the-counter catalog that they can get at no extra cost. Varies by plan. We have a great program called our House Calls program. House Calls is where we have a nurse practitioner that actually will go to our member's house and do an evaluation and meet with the member and just make sure that everything checks out okay, that their prescription drugs look okay, that their home is in a good spot, there's not, hazards that they could trip on, and just do kind of an evaluation of the member. Some of our dual plans even include transportation benefits, and just a lot of great things to kind of help tie in all the different coverage to help make our members live healthier lives. So kind of the whole picture, Medicare Advantage plan provides financial security and helps reduce the costs for everyone, and I'll touch base on that here on the next slide. Medicare Advantage plans also helps people stay healthy through our programs like Renew Active. Medicare Advantage is growing, which I've talked about a little bit, and I have one more slide to show with the growth of Medicare Advantage. And Medicare Advantage has a 90% satisfaction rate with it too. So financial security. One great thing about Medicare Advantage is that there is out-of-pocket expenses are capped each year with their maximum out-of-pocket. So each MA plan will have a max out-of-pocket listed with it, and that max out-of-pocket is going to be the most money that the member would spend on their plan in a given year, given calendar year. And then if they hit that number, every other medical expense will be completely covered by the plan. So some people are worried, well, what if something happens? What if I get diagnosed with something and I'm at the hospital every week and I have a lot of expenses? That max out of pocket is going to help provide that financial security for the members. They don't have to worry about, draining their whole savings on a bad year with medical expenses. So that's helping protect our members from catastrophic healthcare expenses that they could incur. Like I mentioned before, there's also low or $0 plan premiums to help reduce the strain on limited budgets. And an interesting fact, too, is 1/3 of Medicare beneficiaries actually live on less than $20,000 annually. So having that low or $0 premium can really help our members. Another great thing when you work with UnitedHealthcare, we're actually a Fortune 5 company out of the top 500 companies for 2018. One thing that you get with that is stability with our benefits and our plan options. So year over year, when you work with UnitedHealthcare, you're not going to see a lot of spikes and drops in benefits. We try to keep them very stable for our members, knowing that financial security is really important to them, and we don't want to drop the benefits drastically, unexpectedly year over year. So cost reduction for everyone. So research actually shows that Medicare Advantage plans reduce the cost for the whole healthcare system. So some of the efficiencies that carry over to traditional Medicare will reduce the cost for all taxpayers. And this can be through fewer hospitalizations. 31% fewer hospitalizations with people on a Medicare Advantage plan versus original Medicare. 19% shorter average length of a hospital stay. And 25% less money spent on health care. And that's all with a Medicare Advantage versus original Medicare. So how do we help members stay healthy? So across the board, like I've mentioned, 19% fewer days are spent in the hospital with people on a Medicare Advantage plan, and 28% fewer hospital readmissions. And this was done through some of our great programs like Renew Active. Renew Active is a way for members to actually get rewarded for doing some of their health screenings. For instance, our members could get gift cards for getting a mammogram or a colonoscopy or getting some of that preventative care done. They can get up to, a $10 or $20, even $50 gift card to Walmart, Panera, different locations, just for getting some of their screenings done. This program, Renew Active, tries to help encourage our members to stay healthy and catch if they have anything, to try to catch it early so it's less catastrophic and less, harmful for our members too. And then our Medicare Advantage growth. So I talked a little bit about the growth over the last decade, that our membership has actually doubled. So this graph is really interesting to me, especially because from 2012 to 2015, there was actually a 12.3% decrease in our value-added benefits for Medicare Advantage. So because of program cuts. So with a 12.3% decrease in the value adds for program cuts, we actually still grew membership from 2012 from 13.1 million up to 31% or 16.8 million in 2015. So definitely it's very interesting to see some of the growth over those years, even with the cuts to the program. And one of the things that my sales director likes to say is it's not 2005 anymore. So when people start to challenge on Medicare Advantage and not having a big presence, you know, there was a time where Medicare Advantage plans weren't as strong. They didn't have as many value-add benefits. Maybe the networks weren't as strong. But over the last, 10 to 15 years, there's been a lot of additions to the Medicare Advantage programs. And in turn, we've seen a very high increase in the membership. So this is just kind of a history graph to show, where we've gone over the last 10 to 15 years and how much the membership has actually grown. But you can see it stops at 2017. So the next chart that I have in here shows some of the projected enrollment. So there's that article that's included in the handouts that shows that private Medicare Advantage could hit 70% market share. Definitely recommend checking out that article if you guys have a chance. It's included in the handout section. But we are. This graph is going to show too, even over the next couple of years, how much you can see some of the projected enrollment with the Medicare Advantage plan. So this is just from 2016 up to 2026. And what's interesting, so we have 2018, 22 million members on Medicare Advantage plans nationally. Up into 2026, we're expected, with the amount of growth we've had, to hit 30 million members. So definitely a lot of growth, a lot of momentum going with Medicare Advantage plans. And like I've mentioned, a big thing just to take away from this is that if you're not currently offering Medicare Advantage plan, definitely time to add it to your portfolio of products. Not that it's going to be the answer every time, but definitely something when you're meeting with people you want to be able to present and talk about and be comfortable with when working with your clients. All right, next. Trying to go to the next slide here. There we go. Member satisfaction. Thanks. So the next slide here shows member satisfaction. So I mentioned this, members are very satisfied with their Medicare Advantage plan. So 9 out of 10 members say that they are satisfied with their plan overall. 94% say that they are satisfied with the quality of care that they received. 92% are satisfied with their out-of-pocket costs. And 90% say that they're satisfied with their benefits that are received. So I think this is huge when you're talking to your members. I mean, you want to make sure that your members are satisfied, that they're being taken care of, that they're not getting charged a lot of out-of-pocket expenses. And the satisfaction with Medicare Advantage really does speak volumes. The one that stands out to me the most is that 92% of out-of-pocket costs. I mean, for someone that's on, that's over 65, that might be on limited income, to feel that they are satisfied with how much money they're paying for their health care, I mean, I think that's huge and really speaks volumes. All right, so that's kind of what I have for the first portion of the presentation on Medicare Advantage. Some of the different plans available and some of the growth that's been happening over the last 10 years and some of the projected growth as well. Next, I'm going to take a little bit of time and talk about the election periods. There has been some changes in 2019 with the Medicare Advantage election periods that I'll touch on, and then just kind of give an overview of the different election periods that are available for people to switch their plans and enroll in a new one as well. So first of all, annual enrollment period, definitely my favorite time of the year, October 15th through December 7th. Definitely a busy time of the year because it's when people can switch from any Medicare plan. So October 15th through December 7th, people have the opportunity to switch from Medicare Advantage to Medicare Supplement, to anything that they want to. They can switch from different Medicare Advantage plans. They can make that switch. So they can make sure that they're on a plan that best fits their needs. Maybe their Medicare Supplement premium's gone up a lot. They can reevaluate and find a plan that best fits their financial needs and their health needs as well. Any plan change that happens from this time during our AEP will take place with that new plan on January 1st. I'm sure you guys are all pretty familiar with the annual enrollment period. But one thing that's new for 2019 was the open enrollment period. So Medicare Advantage open enrollment period runs from January 1st through March 31st. This is for people that are currently on a Medicare Advantage plan only. So someone who enrolls onto a Medicare Advantage plan, they have a one-time opportunity to switch either to a different Medicare Advantage plan or drop that Medicare Advantage plan and return to original Medicare with a Medicare supplement and a prescription drug plan. So after AEP, they have that one-time election if they choose from January 1st to March 31st to make that switch. Open enrollment actually also works for people that turn 65. So if someone goes on to a Medicare Advantage plan right when they turn 65 with their initial election period, they'll have a one-time open enrollment period after that too, where they can make that switch again from MA to MA or MA to back to original Medicare with the supplement. Then the initial election period as well, IEP. This is when someone's first eligible to enroll in Medicare. With Medicare Advantage, the IEP is 7 months long, and it includes the 3 months before their 65th birthday, the month of their 65th birthday, and then the 3 months afterwards as well. So the initial enrollment period, 7 months long. And for most people, the month that they're eligible for Medicare is the month that they turn 65, where they can use that IEP. Or else it would be ICEP if they're only going on to an MA without a prescription drug plan. So that's definitely a good opportunity to make sure that you're working with members too when they're turning 65. Some people will choose to work past 65 as well, which gives them an enrollment period as well if they work past 65 and then they choose to enroll. Special election period. So there's a variety of SEPs or special election periods that someone can choose to use for different qualifying reasons. So the different special election periods have different rules about timing with them. So some situations that you can have a special election period would be if they lost their credible health coverage, if they move out of their planned service area, if they qualify or lose low-income subsidy or extra help, if they obtain or change Medicaid, they live in a nursing home, skilled nursing facility, or rehab hospital, or if they have a chronic condition. So those are some examples of a spot when someone would have a special election period to make a change with their Medicare plan. One more change that happened with 2019 is the one plan change per quarter with people that are dual special needs plan eligible. So if someone has if someone has Medicaid or low income subsidy, in the past they used to be able to change their plans every month. So they would have an election period each month, and at any time they could switch their plans. In 2019, they changed that, so now they have one plan change per quarter. So if you're meeting with someone that's on both Medicare and Medicaid, it's an important thing to keep in mind that they can make one change per quarter for each of the ones listed. So January through March of the quarter, April through June, and then July through September. The last quarter of the year actually falls during the annual enrollment period. So they would use AEP, and then the benefits would begin on January 1st. For the first 3 quarters, if they use this election period, it would be for the first of the following month. But for that last quarter, it would be a January 1st with AEP. So it's a pretty big change for people that are working with both with a dual eligible clientele. Just something to keep in mind to make sure that you understand and can explain to your clients or members. So some of the election period best practices. So choosing the correct election period, important to listen to customer clues in the conversation to try to see if they might have that election period. Are they coming off of employer coverage? Do they have low-income subsidy? Are they living on limited income and maybe qualify for low-income subsidy? Just trying to pick up on those clues in the conversation to see if you can help them get onto a plan that during the time that they might not typically have a chance to switch, but maybe they might qualify for a special election period. Ask fact-finding questions to get a complete needs analysis. Make sure that you understand all the election period options. As you can see in the last couple slides, there are a lot of different election period options available. It can be a little bit overwhelming, especially with those special election periods that have different lengths, time lengths that they can enroll. If they move, they only have X amount of time versus if they retire, they have a different amount. So we actually have an election period workbook that can help go through and explain the different time lengths that they have available. Medicare.gov is also a great resource to see if they, when an election period, when they might qualify for one. Make sure that you explain the election periods in a consumer-friendly way. It can get a little confusing with the different types that we have. If they don't sign up for that prescription drug plan in time, they could get a late enrollment penalty. So trying to explain the importance of election periods and making those choices in a timely manner so they can avoid penalties is very important. And finally, use the resources that are available to you. I mentioned the election period guide. You can download that through uhcjarvis.com. LEAN is our electronic enrollment application. So you can actually take enrollments in Medicare Advantage prescription drugs and Medicare supplement plans online. And with LEAN, it's great because it helps filter out some of those election periods that someone might not qualify for. So it helps make sure that you're selecting an enrollment period that works for your member. And then PhD is our producer help desk. When you're contracted with UnitedHealthcare, you have access to the producer help desk. One of the changes with the quarterly election period with our dual eligibles, if you're unsure if they've used that quarterly election period, you can actually call into the producer help desk and they can let you know if the person has used the quarterly election period or not. And they can actually let you know if you're just not sure if the person has an election period. The producer help desk is great. They can make sure that they can help walk through the different election period options and see if they might have something that they qualify for. So I can't say enough good things about PhD. They've been a great resource. I even call them occasionally. They are very knowledgeable and have a lot of really great information that they can share. And then finally, your agent manager. So I'm an agent manager in the Nebraska market. We have agent managers all across the country. So if you want to get connected with your local agent manager, we can definitely help you get connected with them. If you call in a PhD, they can get you in contact with your agent manager. Or else I have a list of the agent managers across the country too that I can share. And we can help get you in contact with your local agent manager to help answer some of these questions for you as well. All right, so finally, ready to sell. It's that time of year, it's July. July is the fun certification time. If you are if you want to get ready to sell for 2020, the certifications this year with UnitedHealthcare have gotten a little bit easier. So I mentioned Jarvis a couple times, so here's that website, uhcjarvis.com. When you log into Jarvis, it's kind of your one-stop shop. So Jarvis is going to have resources on different election periods, different plans available in your area. You can pull up your application status, sales and marketing materials. You can also access your certifications, so Knowledge Center certifications, and then if you click Launch Certifications, it's going to open up a new window for you that says certifications on the top, welcome to your certifications page. Then you can click on the certification button in the upper left-hand corner. There's a couple different routes. So AHIP, 2020 AHIP, if you choose to do that through our certification page, we offer a $50 discount. So that's a really great perk for doing AHIP first. If you choose to take advantage of that $50 discount, make sure you don't launch any of our certifications before clicking AHIP, or else you'll miss that chance to activate that discount. So to go do AHIP, you'll just click the AHIP button, get signed in, take your AHIP, and then the results will transmit over to the UHC page. When you do AHIP, it knocks out the Medicare Basic certification. Then you just have ethics and an AARP course to knock out after that. And then there's one separate course on the dual special needs plan too. So the UHC has made their certifications a little bit easier this year. You have 6 attempts, and you have to get 85% or higher for UHC certifications. For AHIP, you have to get 90%, and I believe you have 3 attempts to do AHIP. So it's kind of a little bit of an overview on the certifications. If you haven't already, it's a great time to get certified. I'd recommend not waiting until the first week of October. You will thank yourself later. You do not want to wait until October. You will be very busy the first week of October. Don't wait to get your certifications done then. Get them done early. Get them out of the way. Get certified so you're ready to sell for 2020. All right. And oops, that's all I have for you guys. I may have skipped ahead to a couple of slides. Let's see here. Did I go too fast? Do you guys have any questions?
Tamara, thank you very much for that excellent presentation. Yeah. That really highlighted, I thought really did a great job of highlighting, the exploding market in Medicare Advantage as to how it's really becoming a very important product that everyone, that seniors need. So when seniors are turning 65, they have the option of a Medicare supplement and a Medicare Advantage plan. And, I really appreciated the myths that you talked about and showing that, those are common myths that can be misunderstood or miscommunicated regarding Medicare Advantage plans. So it's very important that when seniors are, those turning 65, that they know what their options are, and Medicare Advantage and Medicare supplements should be presented in an equally manner to the consumers. With that, I want to highlight a couple of things that, as part of this presentation, there's an article that is available to you to download regarding that Forbes article about Medicare Advantage that talks about 35% of Medicare beneficiaries are enrolled in the Medicare Advantage plans, and that details as to why they believe that number is going to even increase further, especially as it comes closer to 2025. In just 6 years, they say it'll be over 50% of the market share. Also, Tamara mentioned how to get ready to sell. We at Art Jetter and Company are excited to help you become ready to sell for Medicare Advantage plans. Though UnitedHealthcare does not require the AHIP certification, other carriers that we offer do require AHIP. And when you do the AHIP, you can transfer those credits over to the additional carriers like UnitedHealthcare to account for most of the certification. And we at Art Jetter and Company are excited to help pay for your AHIP costs. We'll reimburse you the $125 cost for AHIP when you present us with your 2020 AHIP certificate and write at least one Medicare Advantage plan or prescription drug plan with UnitedHealthcare or any of our other carriers that we offer. Another point to highlight is regarding agency managers. One of the keys to success with UnitedHealthcare is an important relationship with your local agency manager. We at Art Jetter and Company have an excellent means to help you get in touch with your agency managers. Well, we will provide you with strong marketing and lead generating support and help you with your back office in terms of helping you get contracted, with helping you know how to submit business, knowing how to help you use the lean enrollment tool. It's the agency managers at the local level that really know, that have the pulse on your local market, and will reach out. We'll make sure that the agency managers have your email address to reach out to you, letting you know of the trainings that are available in your local market and lead opportunities. I've had agents in markets, for instance, in Houston. The agency manager for UnitedHealthcare in Houston was working with one of our producers who proved to be very trustworthy and was shown that she was committed to UnitedHealthcare's products. And this particular agency manager developed a strong relationship with this agent and gave her leads throughout the year and put her in retail marketing opportunities that just didn't pertain to AEP, but throughout the year. So establishing a strong relationship with your agency manager is key, and we can help you facilitate that. Also, UnitedHealthcare has a great agent toolkit that is very valuable. You can simply log on to their website, access the toolkit. You can pre-populate it with your information, and then print it off and use it as any marketing material. It's already been through compliance, so you can just print it off, take it to your local print shop, and print as many copies as you need. And we can also help you out with that as well. So with that, I do want to open it up for questions, and I'll check to see if we have any questions that anybody has. So one agent's asking about the annual out-of-pocket maximums for the particular market. Those are going to be specific to each individual market, but I can let you know that most Medicare Advantage plans have an annual maximum out-of-pocket cost of anywhere between $3,400 and $6,700, depending on the carrier and the area in which one lives. So, Tamara, do you have any other further information to add to that about maximum out-of-pocket costs?
Yeah, no, that's perfect. That's a good range for the out-of-pocket maximum that I've seen as well. So yeah, we can help get the exact amount for the market that they're asking to after the call.
Definitely. I'll reach out to the agent on that. And also, you can expect to see 2020 plans revealed in early August, I believe. Is that correct, Tamara?
Yeah, so they're going to start doing sneak peeks, I'd say probably in the next 1 or 2 weeks. So end of July, early August, you'll start seeing some sneak peeks with the 2020 benefits and expansion from all carriers. And then, the formal rollouts will probably happen in September. And then, of course, you guys can start sharing that information with clients and members on October 1st.
And once we have that information available, we will post it on our secure website. That's going to be password protected. We're able to present that information to the agents, but we cannot share it. It's not able to be shared with any consumers until October 1st, as Tamara mentioned. One person's asking about how claims are handled and the foreign emergency claims. I can let you know that Medicare Advantage, when somebody's on a Medicare Advantage plan, the claims are paid directly to the Medicare Advantage carrier. They do not go through Medicare. So they go directly to the private insurance carrier like UnitedHealthcare, and they pay those claims. The beneficiaries are responsible for the specific copays that are associated with it, whether it be an inpatient copay or visiting for a primary care physician or a specialist. Regarding the specific foreign emergency claim, I can look further into that and be sure to provide you further information on that as well at a later time after this presentation. I'm just checking to see if there's any other questions that were asked. Here we go. Regarding prescription drugs, yes, UnitedHealthcare is going to have a very strong portfolio of prescription drug plans available. The formulary is excellent. I believe there's 3 or maybe even 4 prescription drug plans that UnitedHealthcare offers throughout the country. With that, I believe that's all the questions that were asked this afternoon. If anybody has any further questions, you can send an email to seniorhealth@jetter.com, and we'll be sure to reply. as soon as possible, or you can give us a call at 800-228-0008. And be sure to ask us any questions, and we can help you get appointed and certified. So I look forward to working with you all. And Tamara, thank you very much for this excellent presentation.
Yeah, thank you so much. Have a great day.